far-reaching and transformative mode of expanding access afforded under the ACA was the creation of the state-based insurance exchanges. Would you tell us more about the nature of these exchanges? How do they work? And what's the difference between state exchanges and the federal option?
The difference between the state exchange and the federal exchange is mostly who runs it. It's not in so much in the operations. The basic model is, look, we're going to create a electronic website where people can go and see what options are available. Insurance companies are going to develop options at these different metal levels, which correspond to how much of the health bill they cover, and whether they have strict formularies or loose formularies. And individual customers, some uninsured, some people in the individual market, those are people whose employer doesn't provide coverage, go in and shop for the kind of coverage they want. If they are under, as I said, 400% of the poverty line, that's $94,000 for a family of four, they get a supplement to buy insurance. And if they're really poor, they will get a subsidy to pay for things like copays and deductibles. That arrangement, a marketplace that's a level playing field, where people go in and look at the premium, look at what's covered, and decide what's best for them, is a very American idea, right? Competition of private providers in a marketplace. What the government did is to structure the market, because we know that in the past we've had exchanges, but they've all failed because people were not required to get insurance. And the advantage of this market, of an exchange, in my opinion, there are three big advantages for the average American. The first one is it's not tied to your employment. So if you switch jobs, if you start a company, if you, God forbid, get unemployed and laid off, you still retain your health insurance. You don't have to switch coverage in any one of those circumstances. And that means that you're going to be with the same insurance company. It's going to be good for you and good for them. You don't have to switch every job. Second, this also, I think, has the advantage that there's going to be downward price pressure. We know that individuals shopping for themselves are going to, price is very important to them, and they're willing to sacrifice wide networks and choosing any doctor for a better premium. That price pressure is going to force insurance companies, hospitals, and doctors to actually figure out how to deliver care better and at a cheaper per unit price. That is very, very important, and I think is going to be a very good item. It also provides a lot of comparison shopping for people, so we can see, and I think this is going to be important also for the private sector, as they look at the prices available in the exchange and say, how does that compare to what we're doing? We're also going to have a lot more evaluation of the quality of these things. The public exchanges are an important item. We're getting private exchanges to offer the same kind of platform to employers so that their workers can go in and shop. And I think this suggests this is going to be a very common mode of selling insurance and is a very important innovation in the insurance market.
So, Zeke, creating an effective health insurance exchange is difficult, but eminently possible. You highlight those successful exchanges like Connecticut. What are the characteristics, and could you give us an overview of some of the success stories thus far?
Well, I think Connecticut is a very good example of a successful exchange. And one of the ironies of Connecticut is when they started a little behind everyone else in terms of time, and initially the federal government is like, you're not going to make it, this isn't going to work. The federal government was sort of suggesting that they ought to go with the federal exchange, and they didn't. And Kevin Cunahan, who's their CEO, I think represents part of the success. There are a number of factors that go into the success of an exchange, but one of them is having a good, talented CEO. And what's interesting about Kevin, in my opinion, among many other things, is that he's very disarming. And he's not this hard-charging guy. But he did work for a health plan, Tufts, so he had insurance experience, provider experience, and then he worked for the Massachusetts Connector, so he had exchange experience. All right, so you've got a guy who's got, I think, the two key elements for a CEO is he understands the insurance world, and he also understands the exchange world. Those are two good things. He also hires a CIO, Chief Information Officer, who's a good tech person. It also turns out his COO, his chief operating officer, is also a tech person. So they've got a sort of double team on the tech side. In addition, they were pretty modest in what they wanted the exchange to do, knowing that they had a sort of timeline crunch. They didn't want the entire world. They didn't want it to have all the bells and whistles. Like Kentucky, they focused on the essentials and not everything else. They also have real-time data. So one of the impressive things is when I visited their facility, they had 3 big television screens where they could see exactly how many people were on the website, where they came from, whether they accessed it from a computer, etc., what kind of device they accessed it from. They could identify where they were getting hung up so they could see what the problems were. They had cumulative real-time data, so how many people signed up, what levels, etc. Very, very important item. They also outsourced. They outsourced almost everything else to vendors, and yet they, ran them or managed the vendors very, very carefully. Vendors are very commonly to government agencies will overpromise and underdeliver, and they were very, very scrupulous with them. And in addition, they had created a very important culture, both internally and with the insurance companies. So they had an important culture internally of a sort of tech startup. We're doing something historical. Everyone can have ideas. Try to have a very flat hierarchy so that everyone would begin offering their own ideas and ways to streamline things. They also created feedback loops with the insurers to make sure that they were involved and engaged and knew that they had a receptive ear. Other things, that they learned is personal outreach. The stores, the bricks and mortar stores they created, and the navigators, very important because a lot of the people who were supposed to come into the exchange world did, not experience in insurance, not sophisticated in it, and you need actually to have a personal connection with them. And you can use that first to get them insurance, but second also to educate them about how to use insurance effectively and not to, just be profligate about it. Having said that, even places like Connecticut, had problems. Their Spanish language version of the website did not work. So these are, as I like to say, they're like every e-commerce site. They're constant works in progress. Every commercial enterprise, whether a bricks and mortar store or an e-commerce site, is constantly working at trying to improve its product line, improve its customer experience, improve knowledge about what's out there. And that's an important attitude we need to foster in these exchanges. You don't build it and go away. You have to run it like a business. It is a business.
What about the history of healthcare reform in the U.S., culminating in the passage of the Affordable Care Act? We will ask Dr. Zeke Emanuel, author of Reinventing American Healthcare, when the special edition of the Business of Government Hour, A Conversation with Authors, returns.